Hello, my name's Nico, and this is my individual presentation number 5. So for my presentation, I chose to do the business question, which patient factors drive insurance charges the most? The industry that this falls in is the healthcare industry, which is one of the largest US industries at 4 trillion plus annually. Insurance costs impact affordability, access to healthcare, and financial stress. And then understanding what drives costs helps insurers, providers, and policymakers when determining how much to charge for insurance. So I use two data sets, two CSV files, both from Kaggle. They are 1,338 rows combined, and the variables that are in those data sets are age, sex, body mass index or BMI, the number of children, if they are a smoker, if they are discount eligible, um, which region they're from, and it is split into 4 separate regions from the US, and then charges and premiums. So then we could see two graphs here, one showing the average charges by number of children and another showing the average charges by region. So these two graphs, we could see it doesn't really have that much of an impact on the cost, other than having, I guess, 5 children. There's a steep drop off there in the price, but we can see that the number of children doesn't impact the cost too much, and then the average charges by region doesn't change much at all by which region you are in, other than the southeast and northeast being a little more expensive than the other two. But we could see that they are pretty similar. So then next we got the average charges by BMI and also gender, and then the average charges by age and gender. And we could see that there's more of an impact between these two than the last two graphs. We could see that the BMI increases with the more um, higher it gets. And you can see the obese class 1, class 2, and class 3 becomes much higher than if you were a normal weight, as they put it. And then there's underweight, which we could see um, underweight females pay double of what underweight males pay, which is also interesting. And then the rest of the way, it's more males pay more than the females. And then we can see in the other graph, the average charges by age. The older you get, the more you have to pay, as we could see, and that is doesn't change at all. That just increases the whole way up for both genders, with males also paying a little more there until we could see the oldest at 55 to 64 paying over double what we're paying the 18 to 24 group is paying. So that's interesting. And then we can see this last graphic, the average charges by smoker status. If you're a smoker, you pay around 4 times more than if you're not a smoker, which is interesting, but it also makes a lot of sense because it's a unhealthy habit. So you're going to pay more for insurance if you're going to have bad healthy habits. So that's interesting. And then we could see my ETL plan here. Extracted CSV data sets from Kaggle. I then clean the data by removing any duplicates or missing values, and then merge the data sets together. And then I loaded the data using pandas to load data sets onto Colab. Here's my analytical plan. The chosen analysis I chose was regression plus statistical exploration. Because scatter plots, we could use those for numeric predictors, and then box plots for categorical predictors, and then a correlation analysis to find the correlation between the two, and simple linear plus multivariate regression to estimate the effect sizes. And then Y regression, I chose this because it shows which variables matter the most. It quantifies size and the direction of the impact, and it is standard in healthcare analytics and insurance actuarial science. So then the industry best practices we can see here are GLMs, which are generalized linear models. You got risk adjustment models to determine the risk of patients, the predictive modeling for premiums to determine the price of the premiums, Cluster analysis for patient segmentation, and then cost forecasting models to determine the cost of what an average patient will be. So some key results here. The strongest relationships we saw that smoker status charges 3 to 4 times higher. It had the biggest impact. Age has a steady upward trend, as well as BMI, and higher BMI equals higher charges, especially for smokers. And then minimal or weak effects, you can see gender, region, and children, they all did not have much of an effect at all compared to the other three groups. And then the values of the business, stakeholders who benefit are insurance companies when determining their pricing models, healthcare providers when determining the risk assessment of patients, public health agencies, and employers offering benefits. They all benefit from the stats, business impact, more accurate premium pricing, better risk stratification, and identifying preventable cost drivers, such as patients that smoke. And then the influence KPIs, cost per patient, claim payout forecasting, risk adjusted revenue, and medical loss ratio. These are all important factors when determining how much a patient should pay for insurance. And then just some challenges. There's no medical history in these data sets. It's a small data set, only 1,338 patients. No longitude data, just one single snapshot. There's no income, education, or lifestyle factors to help determine. There's the BMI is self-reported, so it may contain bias by giving higher or lower BMI. Region variable only has 4 categories. There are more regions in America, but this one's only into 4. And then there's no data on the type of insurance plan that people are paying for, just all one insurance plan. And then some assumptions we can make: our charges are accurately reflect the total medical cost. A data set is representative of a broader population, and variables fully capture risk factors. And then some data enhancements. Additional sources that would help are census data like income, education, demographics, chronic disease prevalence. If someone has a chronic disease, it's obviously going to drive up their insurance costs. And then prescription records, also what type of medication they're taking, can drive up their insurance costs. And then new useful variables, the chronic conditions, income level, and then healthcare provider density. These all could help determine the price of insurance and the patient factors. And then how could be joined geographic keys such as zip code, county, or the region that they're in, temporal keys, what time it is, what year, month, and then the patient ID if extended data sets do exist. And yep, so that is all. Thank you for listening. And then let me know any questions that you have. Thank you.